Hi, here's what you should consider while opting for orthopedics. This is just to give you a context so you can decide if this branch is for you or not. We spoke about residency, we spoke about fellowships, but what happens after that? So, you might think of practicing in a medical college, that means doing a senior residency, but the reality is harsh. The last time I went for a senior residency seat, there were 16 seats but 96 applicants. And this goes on rising every year. And even if you get through, so as a new SR, you usually do nothing. You are sandwiched between professors and residents. You are working but not really learning, not really operating. So you think, let me try a corporate hospital. You walk into a hospital with your PG, your fellowships, your credentials. They will take you as a clinical associate, which basically means residency under one boss. So, just like bosses, some bosses teach, some don't. Whether you get to operate depends entirely upon somebody else's mood. So, then you think of starting your own clinic. But the truth is, orthopedics in a clinic is nothing. You can see patients, prescribe x-rays, give medicines, or give some plaster, but real orthopedics is an operation theater, trauma care, casualty. A clinic cannot give you that. So then what you do is, you might as well think of starting a clinic and joining a hospital, a regular hospital. So you look at hospitals and there you see another game, operation theaters that look like kitchens, where you are forced to ask yourself, should I even operate here? And in better hospitals, the bargaining begins. For example, if somebody has a tibia fracture, for a tibia nailing, you might get just 5,000 rupees, no matter if the patient has been billed 50,000 or 1 lakh. You are put in a queue virtually with other orthopedic surgeons. The hospital calls you and asks, how much do you charge? Whoever quotes the lowest gets the call. That's how surgeries are decided. And yes, maybe 2 out of 10 doctors do not go through this at all. But I am not talking about exceptions. I am talking about what the majority of the doctors face. And in big hospitals, there are already established consultant surgeons. So no one even lets you stand over there. So the last option you have is starting your own setup, either in a rent at a rented place, or if you have good finance, build your own hospital. And that's where the real numbers hit. You need a C-arm, which costs around 15 lakhs, an anesthesia workstation for about 4 to 5 lakhs, an OT table around 2 to 3 lakhs, a modular OT around 5 to 6 lakhs. So every single thing has two choices, the cheap version and the version which will actually last and give you good results. You can get a C-arm for around 10 lakhs also. You can get an OT table for around 50,000 also. It's always a choice. Now, for my hospital, I have bought the best equipment because as a surgeon, my reflection is in my operation theater, not in my car, not in my OPD. But even after, when you have spent all of this, it doesn't stop. You still need certifications, endless certifications, and most of them are less about quality, more about extracting money from you in the name of authority. And this is not limited to just orthopedic surgeons. This is rather for every other hospital. And then comes the patient side, where you when you finally set on your own, patient come with expectations. They want 100% results, zero scars, zero complication when it is about a private hospital. But biology doesn't work that way. A fracture is like a cracked mirror. You can fix it, but the crack always stays visible. Patients rarely see the effort, they only see the outcome. So after residency, after fellowship, after all those years, you are still fighting the cost, fighting the system, fighting the expectation, fighting the tax, and fighting the authorities for certifications. That's the reality of orthopedics after post graduation. And if all of this sounds uncomfortable to you, then maybe you should consider before opting for residency in orthopedics, or rather, for this part, any surgical field. This ends the part 3 of why you should avoid orthopedics. You know what's coming next? My favorite. Why you should do orthopedics. And let me tell you one thing, I do not regret doing orthopedics even 1%. See you there.